Hi, Jean. Hi, Dick.
Hey, Teresa.
Hey, Teresa.
So I am just so grateful that you are willing to be a part of this conference this year. And when I recently got involved with Jean and doing work with eating disorders and IFS, and then talking to the two of you, it's like, would you be interested in doing this? And this is why it's important for me to bring all of this learning and expertise to Evansville, Indiana. So what this has turned into is not just like a great opportunity, like, and I really believe a once in a lifetime opportunity to hear you speak live and to train and to teach, but to bring together all of these amazing experts from the IFS world and the eating disorder world for this 2 day kind of get together, both in person and then, virtually as well. So I can't thank the two of you for both saying yes and coming. And so I just wanted to give you both an opportunity to maybe talk a little bit about why you think using IFS as is like the modality to use when treating and healing from eating disorders, and also talk a little bit, maybe give us a preview about the talk that you'll be doing at the conference.
Well, thank you, Teresa. And, you know, uh, part of it is that I miss you and don't get to see you very often. So
Mm-hmm.
that had a big role in my saying yes. And also that I started my career with eating disorders, at least the IFS portion of my career. And those clients taught me the model basically in the beginning. So I feel a great debt that I owe the eating disorder world and that I want to kind of give back. And so, and then, as you know, Jean and I met
Mm-hmm.
because of eating disorders and
Mm-hmm.
was all formative for me. And
That's
the,
right.
the power of transforming an agency or a treatment center and just
Mm-hmm.
to watch what we could do with eating disorders
Mm-hmm.
when everybody was into this. And I don't work that much anymore. I don't work as a therapist that much anymore, but I kind of miss the eating disorder
Mm-hmm.
community. So when you asked us about it, I got excited, and uh, I'm glad I'll have 3 hours to speak about it. And I've got a nice video with somebody with a
Mm-hmm.
binging issue, and yeah, really looking forward to it.
Great.
Mm-hmm.
Yeah.
Yeah. Yeah. I hope this isn't a once in a lifetime, Teresa. Maybe this will be an annual. I don't know.
Maybe. Yeah. Yeah.
Um, it is exciting to be able to meet up with a lot of folks that we, got to know, what, 15 years ago when I
Mhm.
first met Dick. And, you know, uh, the sense of agency, right? The sense of clients having within themselves what they needed, and that IFS could give them the tools that they could then take out and sustain their recoveries was just tremendous. It was so, I was like, I have to learn this. I have to see how my clients are doing this. And so that is what brought us together, but it's really just been unbelievable, the impact. And so I'm really glad to reconnect with you and to do work together with you. And when you were talking about your own recovery and the messages you got, like I think my talk is going to be about unburdening therapists or the clinicians, um, parts to help facilitate the client's unburdening of the parts who carry extreme beliefs about food and bodies. And really, IFS allows people to really get curious instead of feeling shame, and to start to notice some of those limiting beliefs, like people who say, oh, there's never any total recovery, from an eating disorder, or I'm always going to feel some amount of shame. And I think there's always room for unblending, getting to know parts who can newly take on shame. But I think the more we get a sense of how much parts of us are holding those limiting beliefs, we can open up much more of a self-led space for our clients to do that kind of healing. And so for me, it's so exciting that you're doing this to get so many people together, because one of the things that's been hard in the eating disorder field in general is the sense of connecting with like-minded people, right?
Mhm.
And so having a sense of who's available, who's around, the dietitians, the physicians, psychiatrists, and the therapists is so exciting to us, right? To
Mhm.
start to develop more of a network, for this. It's so powerful. So I'm feeling, really excited about it, to be able to do it. And I think especially when people work with disordered eating or eating disorders, they often feel so alone and with they're kind of embedded in so many interlocking systems with so many different parts, right? It's very easy to start getting blended with the fear, the frustration, pressures from other people to get recoveries, make recoveries happen, lack of insurance or support. So anything like this that gives an infusion of, self-energy to all of us who are doing it and community, I love that.
Yeah.
Really excited.
Yeah. Great. Well, again, I don't want to take more of your time. I just really wanted to be able to get out there kind of the word so people know that there's this opportunity to come see you live. And also virtually, we have someone coming from Ireland in person, as well as from all over the country and Canada, and then a lot of people virtually too. So I just want to thank you both so much. And I look forward to seeing you in a couple weeks.
We look forward to it.
Me too.
All right. Bye.
Bye-bye.